Today I want to talk to you about shoulder issues. This comes in the clinic commonly. People either they'll sleep wrong on their shoulder, or they'll start a new exercise program. Really, shoulder problems come on just a lot of times gradually. I guess that's the most common way they come on. It's like all of a sudden over a few days or a few weeks, a person starts having shoulder pain. They'll notice, if they're reaching a little higher, or they're reaching out to the side, or some specific thing they do that triggers their shoulder pain. And so a lot of times they'll lose some range of motion. They'll lose the ability to come up like this, or they'll lose the ability to come up like this, and their shoulder will begin to hurt. One of the common things that causes it is you've slept on the shoulder in a strange way, especially if you're sleeping on the shoulder or on your side with your shoulder or your arm above your head. So if your arm's like this, your arm's like this, it puts the shoulder in a bind, and that causes shoulder pain. I guess the most common condition in a shoulder that causes pain is likely an impingement. And that usually happens once we get in our 40s or our 50s and beyond. And so the tendons for the rotator cuff come up around the back of the shoulders. So there's 4 tendons that come around. 1 comes up under, 3 come around like this. It's called your rotator cuff. And those tendons wrap around and hook into the shoulder here. And those tendons cut underneath the collarbone. And when they go underneath the collarbone, they can get entrapped right in there. They can get squeezed in between your collarbone, up under your collarbone as they pass through. And so when you hold your arm like this, or you're working out above your head, you can irritate that. And then as we age, just the friction of the wear and tear causes that tendon to get thicker. And that can also cause an impingement. So impingement is not the end of the world. It's not a torn rotator cuff, but you do have to quit doing whatever's irritating it. The other thing that causes shoulder pain is bursitis. Now, bursitis is simply you've got these little sacs of fluid in the shoulder. You got one here, you got one out here, one right in here. Those little sacs of fluid keep the tendon from frictioning on the bone. So it allows that tendon to glide easily on the bone. Those can get inflamed and get irritated. And then also you can get what used to be called tendonitis, what we now call tendinopathy or tendinosis. And that's just where the tendon itself, so you've got your muscle, all kinds of muscles in your shoulder, where the muscle hooks to the bone, that little section that usually looks white on an anatomy chart, that is called your tendon. And so the tendon is fibrous, and it can get irritated. It can get little tiny micro tears in it, and then that will cause you pain. Also, we see a condition called frozen shoulder. Frozen shoulder is technically called adhesive capsulitis. Adhesive capsulitis is when you can't move the shoulder. People get their shoulder stuck. It's more common in women. It comes on for a lot of times no apparent reason. It can be hormone related. It can be an injury of some sort, but you'll have a patient come in and they'll not be able to get their shoulder up here, or turn it like that. And a lot of times it gets worse and worse. Frozen shoulders actually many times will resolve over a 2-year period of time, but a lot of times we can help those too. Along with all that, you can also get just arthritis in the shoulder. So as you age, a lot of times the patient will come in and it seems like they've got frozen shoulder, but they've actually got arthritis in the shoulder. We can x-ray that and figure that out. So we treat the shoulder in various ways, but one way we treat it is we try to get your range of motion back in the shoulder. We kind of force the range of motion. We know how to do that. We also treat the tendons. We have ways that we can treat the tendon and the bursa. We have to usually get down deep in the shoulder to treat that. A lot of times we'll use a laser to treat the shoulder to get the inflammation down and get the healing to happen in the shoulder. And then sometimes you'll get a shoulder pain that actually is your neck. Your neck can get a pinched nerve run past the shoulder, and that will cause you pain. A lot of times people will come in with a shoulder pain and they'll think it's down here. That's usually a referral pattern. They're hurting down here, but their actual issue is in the shoulder. And so we've got ways that we can tell you why we think you've hurt your shoulder, what the condition is, and we have ways to treat the shoulder, and we generally get very good results with it.